welcome to my channel. My name's Marissa and this is Life After the Fontan. Thank you so much for joining me today. If you're new here, I'm a 24-year-old living with complex congenital heart disease, documenting my life. And if you're returning, thank you so much for coming back. Today we're going to be talking about exercise stress tests. Please remember to subscribe to my channel, like this video, and even turn on that notification bell if you'd like to be one of the first to hear about my upcoming videos. So let's get started. An exercise stress test, or what I'm going to be referring to as a stress test from this point forward, is a test that's used to really look at how well your heart works when it's working, really, when it's being exercised. This is something that is used very often in adult heart disease patients when diagnosing things such as heart attacks or other coronary issues. To my understanding, a stress test really looks at how high your heart rate is going, or if it can get above a certain number, how your vitals are looking, how your oxygen is doing, is it dropping too low, is it staying where it needs to be, and how well you're actually able to complete this test. Most stress tests follow a specific protocol. I'm not going to share the name here because I found the protocol on Google one year and I trained for it, and that is dangerous and I'm not at all recommending it. So I'm just going to call it a protocol. Most stress tests follow a protocol where if you're on a treadmill, for instance, the incline and the speed will increase every 3 minutes, and then the same will happen on a bike, but instead of an incline, of course, it will be the resistance. Something that is frequently measured for my exercise stress tests, though it was not this past time, is the VO2 Max. And I'm a cardiac nurse, but no way am I an expert in exercise physiology or even anywhere close to that. But if I'm explaining it correctly, really looks at how much oxygen your muscles are using up, really. So when I'm sitting here breathing in the different gases in the air, there's 70% of something, something else of another thing, and 21% oxygen. So I breathe in that 21% of oxygen, and the VO2 max is looking at how much oxygen I'm breathing out. Am I breathing out 20% of it, meaning my body's only using 1%? Am I breathing out 11% of it, meaning my body's using 10%? It really differs on what you're doing. So while I'm sitting here and talking, maybe I'm using 3 or 4%. I don't know. These are numbers I'm just throwing out. But if I'm on a treadmill, maybe I'm using 8% or 7%. However, when you think of someone such as an Olympic athlete, their VO2 max is definitely going to be much better than mine because they're in such great shape and they condition and they train for their exercise. So when they are exercising, their VO2 max may only be maybe 5%. So a VO2 max, when they are testing that, I usually have to have a clip on my nose and something in my mouth that measures the oxygen that I'm really exhaling. However, like I mentioned, I didn't have that for this exercise stress test. So I'm going to share a few videos from my stress test experience, and I just want to mention that the healthcare providers that may be seen in these videos did consent verbally to having themselves posted on YouTube. I won't name any names, but I love them, and they are actually at my pediatric hospital with my pediatric cardiologist, who I've been following for as long as I can remember, and I'm usually there yearly to have these stress tests done. So let me explain what really happens when I get into the room for a stress test. The first thing I do is sit on an exam table, and I have heart monitor leads put on, a blood pressure cuff, usually sometimes a pulse ox, and I lay down and I have my pre-exercise vitals taken. So my blood pressure will be taken, they'll take a quick snapshot of my heart, I believe, and then I'll sit up. They usually take another set then, and then I stand up and I walk over to the treadmill. Now, when I was younger, I actually completed this test on a bike, but we'll talk about that in a little bit. So then I get over to the treadmill and we start the stress test. So that would normally be when the VO2 max equipment would be put on. However, that won't be in these videos. So the treadmill really usually starts off pretty slow, like this. it gets a little faster like this. And then even faster. And faster. Whenever I feel too tired to continue or out of breath or any of those things, I usually say that I'm done. We stop, and then I go over to the exam table again and I get all of my vitals taken again post stress test. So let's talk a little bit about stress tests and what they mean to me. I had my first exercise stress test when I was 11 years old. The reason I had this stress test was because my parents noticed that I was having difficulty keeping up with my teammates when playing soccer. Now, they weren't really sure what the cause was at first because I was at the age where we switched to a bigger soccer field, and I also played on a position where I would run up and down the field the entire game. So I had a stress test done. My first one was on a bike where I mentioned earlier the resistance changed every few minutes. I believe it was mimicking riding up a mountain, kind of. That's kind of how I remember it. And I actually had stress tests on the bike probably for 4 times, I would think. And then I switched over to the treadmill when I got old enough to. So after that very first stress test when I was 11, a lot of things kind of changed for me. And while it may not seem like it, I had been restricted from playing sports. I had restrictions in school for gym class. And it was really one of the first times that I felt different from my friends and singled out from my peers. I went from having soccer practices twice a week and a soccer game every weekend to just going and watching those games. This was, I believe, right before or right as I was entering middle school, so 6th grade. It was a new school, things were very different at school, and there were just a lot of changes happening in a small amount of time, I remember. So what I did when I was no longer able to play soccer, something I plan to do forever, I instead joined the school chorus, which I was in until the day that I graduated. We sang at my graduation. I joined show choir or like musical theater or whatever you want to call it, where we would put on musicals and shows. I started taking piano lessons, hence the piano next to me. And that was really my new thing from that point forward. So I think really with that experience, stress tests are, no pun intended, stressful and scary for me. The first one I had changed so many things in my life, and I've always been afraid and fearful before my yearly appointments, wondering, is this going to be the one where something's wrong and I have new restrictions? Is this going to be the one where they put me on more medicine for my heart? Is this going to be the one where we get bad news? And I was almost certain that we were going to hear something negative at this stress test appointment because I've been having issues with lower oxygenation. That's actually the whole reason that I had this stress test in the first place. I actually had somebody ask me after my stress test why I still went to a pediatric or a children's hospital to complete this test as opposed to having it done at the ACHD clinic I'm seen at. To be quite honest, the people that are there with me every single time I have a stress test are almost like family to me, and I couldn't imagine, honestly, going anywhere else. It's already such a stressful experience for me, and I'm pretty lenient with diagnostic procedures, with anything. But for that reason, the familiarity that I feel and the comfort that I feel when I go to my healthcare providers and have my stress test with the same person that's been doing it since I was 11, that changes a lot for me. And I really have a tough time imagining the future if and when I start having stress tests at the ACHD clinic. So, in the end, I received great news from my stress test. I was told that it was as good as it gets, really. I hope this video is able to help educate somebody who may be preparing for their first stress test, whether it be on a treadmill or on a bike. I've really been having them since I was 11, and although every year I count down the days and am fearful for them, the minute I'm done, or really when I'm on the treadmill, I always think to myself, why was I so worried about this? It's just exercising for a little bit. So I think that's really all that I have for you guys today. Please keep an eye out for my upcoming videos. Some ones that you can look out for are a Q&A with my boyfriend Ben, and also a video where I talk about actually what it's like to grow up with congenital heart defects. Thanks for joining. Bye everyone.